first step that you use. Can you walk us through it?
Sure. Well, this is the Venefit procedure. This catheter is inserted into the vein that's not functioning properly, and it's passed up the thigh, up to the groin area. Then the catheter is turned on, and it actually heats the inside of the vein, destroying the inside of the vein, and it does that over a 7-centimeter length, and then you pull the catheter to the next section and then destroy that vein that's not functioning. This procedure takes about 3 to 4 minutes, the actual heating and sealing of the vein, and it's done in the office with the patient awake. So this is a outpatient procedure where you come right in the office, have this done, and out the office by yourself.
Because this is an accessory vein. Luke doesn't need this vein, so you're essentially creating a process here where this vein no longer is going to have this blood backed up in it.
Correct.
And then you have a second step that I think we also have some footage of. What are you doing here?
Well, once I took care of the underlying problem, then I had to address the more superficial problem, the bleeding vein. And so here what I'm doing is injecting veins that are at the skin surface using a sclerotherapy agent to destroy the vein, which then happens over a period of weeks. Here you see the vein disappearing immediately because it's being filled with that solution, but then the actual process of it sealing will take a few weeks for that to occur.
Dr. Dietzek, I mean, you mentioned how many millions of people have this. I think a lot of people don't realize there's a much better way now to treat it. The old days, you had to do vein stripping, larger incisions, tie things off, pull the veins out. Now with this radiofrequency therapy, I mean, that offers a huge innovation for people with varicose veins. You know, question, typically you think of varicose veins more in women than men. Why, in this particular case, do you think he was set up to get this?
Well, this is a genetically predisposed disease, and there are certain things that will accentuate that predisposition. Luke has a job where he stands for long hours of the day, and this just potentiated his venous condition such that he ended up getting these large varicose veins.
Can you speak a little bit then, because it is genetic, and we all know family members, you know, you can look and say, oh my God, I hope my legs don't look like that when I grow up. So what are some tips that we can do on our daily basis to just kind of minimize our risk of developing severe varicosities?
Well, with regards to your genetics, you can't run away from that.
I know.
But as far as the other things that you can do is avoid long periods of standing, wear compression stockings if you're predisposed.
Okay.
When you're not standing, elevate your legs. Other things that you can do is eat a healthy diet, make sure that you're high in fiber so that you avoid constipation.
Because constipation, if you're straining on the toilet, you can increase your varicosity.
Correct.
And the important question, Luke, how are you now, my friend?
Doing much better, and I don't have to worry about my leg bleeding out anymore.
And Dr. Dietzek, we appreciate you joining us. And the good news here is, as Dr. Orton mentioned, superior treatments now for those suffering from varicose veins, but prevention, boy, that is the best treatment of all if you can do so.